Hello everyone, this is Dr. Vijay Raghavan. Welcome back to Vijay's Wisdom. Today's topic is on a symptom of chest pain. This is the most dreaded symptom both for the patient as well as the medical professionals. Not every chest pain is from the heart, but most important cause for a chest pain or most scary cause for a chest pain is heart attack. We are all worried about that single event of heart attack when there isn't chest pain. But as I said, there are plenty of causes for chest pain. Non-heart cause for chest pain is more common than heart attacks. So what are the other causes? Acidity. People always blame their acidity and ignore chest pain due to the heart. They do have repeated chest discomfort due to acidity, and when there is a chest pain due to heart issue, they tend to think that it is acidity. This ignorance is not only in common man. Even medical people get misguided by this acidity as a cause for chest pain. Gallbladder stones with infection, we call it acute cholecystitis, they can develop chest pain. There is an entity called acid reflux disease, and this is again very commonly quoted by common man. It is very common in obese people with high intra-abdominal pressure, leading to acid entering into the food pipe or called esophagus, causing burning pain in the chest. Other causes for chest pain are panic status. Ulcer diseases like acidity can create pain in the upper abdomen and chest. Sometimes lung conditions like infections and pneumonia or fluid in the chest can produce chest pain. Shingles, which is a viral disease affecting the skin over the chest, can cause significant pain and people may mistake it for heart attack. Now let's come to the most dreaded real heart issue causing chest pain. This chest pain from the heart is called angina pectoris. Angina is a pain, pectoris in the chest. So this is the most feared chest pain, and it is from the heart. Every one of us are aware and scared of this pain from the heart as a cause of chest pain. We have to have a full understanding of this. Once we know what it is, and we can get to know what should be done. So how do we identify that this pain is from the heart? This is more a discomfort in front of the chest behind the front bone, that's called sternum. So you feel a discomfort behind the sternum in front of the chest. It is often felt as a pressure, heaviness, squeezing, burning and choking. See the different patterns of pain that can happen from the heart. So remember, this is not an excruciating pain like what we see in the movies. Often you see people rolling around and holding the chest saying that, oh, he has developed a heart attack. Pain in the chest from the heart attack is not very severe or excruciating. That is the most important thing we should remember. It may be felt in the upper abdomen or tummy. It may be felt in left arm, back, neck, jaw or shoulders. Look at the variations in the site of pain when the pain comes from the heart. It can be anywhere, but commonly it is felt in the arm, shoulder and neck. What initiates this chest pain from the heart? What is the precipitating cause for the heart-induced chest pain? It is often precipitated by exertion, eating, exposure to cold and emotional stress. The most important point is it lasts only for few minutes, 1 to 5 minutes. 5 minutes also is too long. It lasts only for few minutes, and it is often relieved by rest or medication, that is sarbitrate under the tongue. If the chest pain disappears with sarbitrate under the tongue, you can be very sure that it is from the heart. So what are the important points to remember? Short duration of pain lasting only for few seconds are not from the heart. The pain due to the heart attack does not change with breathing. If I take a deep breath, my pain is becoming more. Rest assured it is not from the heart. When you cough, when the pain becomes more, it is not from the heart. So any change in the intensity of the pain with breathing, coughing or changing in position, it is not from the heart. That is very clear. Pain above the jaw, in the forehead or in the nose or below the upper abdomen or the tummy is unlikely to be from the heart. If the pain is aggravated by pressing the chest, is another important point to remember, that the pain is not from the heart. If I turn around, the pain is becoming more. When I press on the chest, it is becoming more. These are the signs that they are not from the heart. What is this basic of angina pectoris? That is a pain from the heart. Oxygen and nutrient supply to the heart is compromised. That's the basic. The heart is not getting enough blood circulation, so it is starved of oxygen and nutrient supply. What happens? Why it is happening? This may be due to a reduced blood flow through the coronary arteries. These are the main vessels that supply blood to the heart, due to thickening of the vessel. What we call it atherosclerosis in medical terms. When the heart is big due to any cause, commonly being long-standing high blood pressure, this may lead to deficiency of the blood flow. Obviously, when the heart becomes big due to any reason, the demand increases, and if it is not met with the enough blood circulation, then the patient develops deficiency of blood circulation to the heart. When the oxygen is carried in the blood is low due to any reason, that can again reduce the oxygen flow to the heart, causing chest pain. Spasm of the coronary artery, when the coronary artery suddenly clamps on itself, which may be relieved by medication before major damage can be done. This is very important, but we do not know as to whether it is block or it is spasm. Spasm is completely relieved by taking sorbitrate under a tongue. Immediately it relaxes the muscle. So if there is no further damage, the heart muscle will return to normalcy if you have taken sorbitrate, if the heart pain is from spasm of the coronary arteries. Now, we talked about what are the features. Who are the people who are likely to develop chest pain due to heart? Person already known to have defective blood supply to the heart, that is coronary heart disease or ischemic heart disease, they have the highest risk. People who are known to have reduced blood circulation to the heart is the person who is likely to develop angina pectoris or heart-induced chest pain. Other people who are at risk are high blood pressure person who is smoking, who is a diabetic, who has got a high cholesterol, obesity and overweight. Being a man itself is a high risk. Important point is that women are not affected by thickening of the coronary arteries as long as they are menstruating. So up to 45 to 50 years, they do not have any issue in the heart blood circulation. After the menopause onset, their tendency to develop thickening of the coronary arteries starts, and by the time they develop chest pain due to heart, their age is advanced, so they may have more complications than men. So we saw that men develop chest pain due to heart more commonly, whereas women develop it later in life and their complications are more. What precipitates this chest pain? Any cause for increased heart rate. This is basic logic. When the heart is pumping at 70 times per minute, its blood circulation is enough. But if it starts pumping at 120, 140, when the rate goes up, obviously the oxygen demand by the heart is more. So if it is not met, it will lead to ischemic heart disease. So what are the normal causes for increase in heart rate is fever, emotional stress. Either you are very happy or very angry, very stressed, depressed, anxiety, all this can increase the heart rate. Unusual exertion like sudden physical activity can precipitate a heart attack due to increased heart rate in a person known to have a deficiency of blood circulation to the heart. So this rise in the heart rate increases the demand for the oxygen, which cannot be met with increasing supply due to partially blocked coronary vessel. This is what we said just now. Normally, the coronary arteries are able to increase the blood flow to 4 to 6 times. So when there is an increased demand, coronaries are able to dilate and supply 6 times the normal blood circulation. So the basic problem is either the demand is more, coronary arteries are diseased that they are not able to expand. Let's take a slight deviation or little diversion from the loaded topic. Why isolation in intensive care? I think most of us would have wanted like this. When we are allowed to meet the patients in different parts of the hospital, intensive care does not allow everybody to enter. So have you ever wondered why such hype about this intensive care, ICU, and its strict rules and regulations? This is more relevant to our society. See, we Asians are very emotional type of people. Both the person admitted in ICU and the relatives are agitated and emotionally charged. Our social norm is to visit the sick, to share their grievances, give them some fruits, and give a bit of unsolicited advice. This is very important point here, and we go and talk to them and tell them what we think should be done for the patient. Anyway, this is prevented by intensive care. Intensive care prevents social visits or relative visits. Somebody, friends, relative visiting you. The question is why? Why should somebody be prevented when visiting a sick person in intensive care? It's natural for a person to get emotional seeing his or her relatives, causing the heart rate to go up. As we said, it is not safe to have increased heart rate, especially when the patient is admitted with ischemic heart disease or heart attack. It is not comfortable for someone to be isolated. Suddenly, I am getting admitted in intensive care and I do not know anyone in the intensive care unit. I feel agitated. I am worried. Is it the end of my life? So they get anxious about the surrounding, about being isolated from their family. That is why they are sedated. So that emotions, anxiety do not raise the heart rate or blood pressure. Calm, dimly lit surrounding adds to the comfort of the patient. That is why visitors are not allowed to see patients in intensive care. We do not want any increase in anxiety, emotional moments causing increase in the heart rate, which is detrimental to the recovery from the heart attack. Let's get back to our original topic. So the heart attack happens when the vessels are narrowed or vessels go into spasm, or when the oxygen carried by the blood is low due to any reason, or flow to the heart is reduced due to BP being low. When the blood pressure is dropped, then circulation throughout the body is reduced and automatically flow to the heart is also reduced. Drop in blood pressure may be due to any reason like excessive blood loss or failure of pumping of the heart. Somebody is bleeding profusely and the BP drops, then there is going to be a problem in circulation throughout the body, and most essential organs are heart, brain, liver, kidney. Hence, the effort should be made immediately to correct the cause for the reduced blood flow to the heart to save their life. That is an emergency situation when the BP is dropping. So, what are the preventive steps? How can I prevent a heart attack? How can I prevent chest pain due to heart? First, keep your BP under control. Because they are asymptomatic and you are not aware of it, even once you have been detected to have high blood pressure and you have been prescribed medications and lifestyle modification, you tend to ignore because I don't have symptoms. No, that is not correct. You have to keep your blood pressure under control. Control your sugars. Stop smoking. This is very, very important. Smoking is the only self-inflicted damage which is very much preventable. I want to say it again. This is a self-inflicted damage which is very much preventable. Keep your cholesterol under control by physical exercise with or without medications. Another important point is moderate alcohol intake seem to be helping in preventing heart attack. 1 to 2 drinks per day is known to prevent heart attack. This is a true statement. Don't be alarmed. It's a good news for drinkers. But drinkers do not stop with 1 to 2 drinks per day. That is the issue. So the female sex hormone helps in prevention. That is why menstruating women do not develop heart attack or angina, otherwise called chest pain. Lifestyle modification for heart healthy life. Heart healthy eating plan, that is limiting the alcohol, avoiding large meal, avoiding rich food, especially if it triggers your angina. When a person consumes huge or a large meal, the blood circulation to the intestines and the stomach increases for the digestive purposes, which may compensate the circulation to the rest of the body, especially heart and the brain. That's why sometimes you may feel you are very sleepy after a big meal because the blood circulation to the brain is reduced, because the whole concentration is on the digestion and absorption of the large meal which has been consumed. Other lifestyle modification is aiming a healthy weight. If you keep your weight under control, the anginal attacks are likely to be less frequent. Lead a physically active life. Under the guidance of a healthcare provider, start with mild physical activity. Remember, challenging the coronary artery in graded way will induce bypass channels to increase the blood flow to the heart. This is very important point, but it has to be very cautiously done. You should have a monitored physical activity. Any activity which precipitates chest pain should be avoided. But stopping all the physical activity is absolutely incorrect. That is not the way. Oh, I will develop chest pain, so I will be bound to the sofa or bed. That is not going to help you. You challenge your heart up to the extent where you know that you are going to develop a chest pain. That is how you open up new channels of blood in your heart so that your heart gets much better blood circulation. Managing stress is very, very important. Try to avoid any stressful situation which is likely to trigger heart pain. Stop smoking. Very, 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 very important activity. Stop smoking. Get enough sleep. Remember, sleep heals and repairs your heart and blood vessels. Sleep deprivation raises the risk of heart disease, obesity, high blood pressure, diabetes, and stroke. We'll talk about sleep in another episode, sleep and health. So, what do we do with blocked coronaries? There's an entity called stable angina, which occurs in a pattern. One should learn with what causes the pain, how it feels, and how long it usually exists. So one should keep a log as to when they feel the pain. If I do this, I will get the pain. So you should remember. If you can't remember, write it down. If I climb a second flight of stairs, then I develop chest pain. So you keep a log of when you feel the pain. One should know the limit of their physical activity. I do have a coronary issues. I know when I'm going to get a chest pain. So I will exert myself up to that extent. At the same time, I cannot go without physical activity. Hence, one should be able to manage the activities like work, hobbies, and sexual activity. Knowledge of their limitations help them to moderate the activities within the range to avoid chest pain. One should know how to lower and manage stress, like avoiding or limiting the situation that can cause anger, arguments, or worry. This may not be possible all the time, 100% of the time. At least some places where you know that if I encounter this situation, I am going to get upset or anger, try to avoid them. Stay away. Exercise and relaxation help relieve emotional stress. Temperature extremes should be avoided as it strains the heart. Don't expose yourself to too much of cold or too much of heat. Small meals is ideal. If a large meal causes chest pain, not everybody is going to develop a chest pain after a meal. If it happens, do not take a large meal. As I said, when there is an intake of a large meal, more blood is diverted to the stomach and intestine for proper digestion and absorption. This leads to less blood supply to the heart, and that causes chest pain. Now we know how to sort of prevent them. We know when it is going to come. Okay, you have developed chest pain. What are the alarming signs? When should you approach medical help? When there is a change in the pattern, where the angina or the chest pain occurs more often, when it lasts longer, it is more painful, and it occurs without physical exertion. I am lying in bed and suddenly I develop chest pain. This is an alarming situation. It does not go away with rest or medicine. I am just walking, I develop chest pain, I go to bed, relax, bring down my heart rate, but still the pain is persisting. It does not go away with rest and medication. This is an alarming sign. These are the signs that the situation is getting worse and one may be becoming unstable angina, unlike the stable angina. When we say stable angina, we know these are the precipitating causes, these are the preventable causes. When it exceeds that, it becomes an unstable angina which needs medical help. If the pain persists even after taking third tablet of sorbitrate, this is another important point. A person known to have coronary disease is on sorbitrate all the time. He is taking sorbitrate tablets on a regular basis 3 times a day. But he is asked to keep a tablet sorbitrate under the tongue whenever he develops chest pain. Basically, his coronaries are being dilated. In spite of it, some activities causes the deficiency in blood supply to the heart, so you take a tablet. Now, if you swallow the tablet, that has to go to the intestine, gets absorbed, go through the liver, come to center circulation, and then go to the heart. Whereas if you keep it under the tongue, it's directly absorbed from the mouth and it goes directly into the vein, into the heart. So it is shorter in coming into action. So if you take a tablet, first dose, the chest pain is relieved, it's fine. Second dose, if the pain is not relieved. After the third dose, if the pain is not relieved, you got to seek medical help. That is another alarming sign. Before we go further, let's talk about this tablet, magic tablet called sorbitrate. Sorbitrate is a drug which causes the coronary arteries to dilate. Coronary arteries become bigger, wider, to increase the blood flow to the heart. So, during the chest pain, it should be kept under the tongue. Remember, it should not be chewed or swallowed. It gets into the blood directly from the mouth. That is what we said. It relaxes all the vessels so that the BP reduces and the heart need not pump with the force. It relaxes the coronary, it relaxes all the arteries, so there is going to be a drop in blood pressure. When there is a drop in blood pressure, the heart does not need to go and push itself against a high pressure system. So that is another great advantage in sorbitrate. So due to this, that is dropping in blood pressure, one should avoid getting up suddenly from lying position. You have taken a tablet, the chest pain is gone, you don't jump around immediately because the BP may drop when you get up and you may feel giddy. This may cause a drop in blood pressure leading to giddiness and fall. So how and when to take sorbitrate? Take the tablet at the first sign of pain. You think you are developing a pain, take it immediately. Sit down and take sorbitrate as it may cause dizziness due to fall in blood pressure. This we have already said. Second tablet may be taken after 5 minutes and the third after 5 minutes of the second tablet if needed. If the pain persists after third tablet or 3 tablets, call for medical help. If any activity is likely to cause chest pain, it is prudent to take the tablet 5 to 10 minutes before the strenuous or stressful activity. I have to climb a few steps to the temple. I know I am going to develop chest pain. Take a tablet, wait for 5 minutes, your coronaries are well dilated, then you walk across. So, any activity which is likely to precipitate the chest pain should be preceded by taking sorbitrate tablet. So what are the side effects of this tablet? Headache due to increased blood flow to the brain because blood vessels are dilated. Dizziness due to fall in blood pressure. Flushing due to increased flow of blood to the skin of the face. These are the good signs that the medicine is effectively increasing blood flow to all parts of the body. Moral of the story, you take a tablet, sorbitrate, you develop a headache, don't panic. That's a good sign your blood circulation is improving not only to your heart, to your brain also. So the brain is telling you there is increased blood circulation to me. That means it is obviously increasing the blood circulation to the heart as well. Few points about this sarbitrate. Luckily and surprisingly, this drug called sarbitrate is absorbed by skin, mouth lining or mouth mucosa and from the stomach. So it is available in the form of a tablet to be swallowed or kept under the tongue during the episode of chest pain. It's available as patches containing specific dose to be delivered by 24 hours to apply it to the skin anywhere in the body. It is not mandatory that you should apply it on the chest. It's going to get into circulation and it's going to dilate all the vessels. It's available as ointment to be applied in skin anywhere. It's available as sprays. It is available as injections to be delivered by drip directly into the vein. The dose has to be monitored closely under intensive care. Chest pain of non-heart origin. These are also common. Nearly 23% of people experience this. So 1 in 5 will experience a chest pain which is not heart origin. It's common both men and women, but women tend to seek medical help more than men. Mostly these are much younger age group people compared to heart-induced chest pain. Obviously, you think that blood vessels become older and thickened only as you become old. So a younger person, if they come with a chest pain, in all probability, it's not mandatory that it is not from the heart. In all probability, it is not from the heart. Non-cardiac chest pain is a disorder of long duration that reduces person quality of life but has no impact on death rate. This is another one. He is worried about his chest pain, so his quality of life reduces. Though it is not from the heart been proved beyond doubt, but he is still worried about his chest pain. His quality of life is compromised, but it has no impact on death because it is not from the heart. This causes unnecessary cardiac evaluation repeatedly. This is another important point. People come with a chest pain, they have been investigated, ECG, echocardiogram, coronary angiogram, everything is normal. They go back and again develop chest pain. They panic the medical professionals and they go through this test again and again. So it has to be impressed on people that it is not from the heart. In spite of repeated investigation, they tend to panic again and panic the medical professional to repeat the whole thing. So this repeated unnecessary cardiac evaluation is being done. Commonest cause for non-heart chest pain is acid reflux. It is often relieved by medication, antacids, omaze, that's a very common thing. You all talk about Pan-D. So pantoprazole will reduce acid secretion for 24 hours and this pain will disappear. Panic disorders, anxiety and depression are other common causes. As we said before, peptic ulcer disease, gallbladder stone with infection can cause chest pain. Another important reason is the pain from the second rib in front of the chest. This is a sharp pain precisely in one point, often aggravated by pressing the spot. Other cause for non-heart chest pain is when the projection of stomach into the chest, what we call it as hiatus hernia. This can cause chest pain. The most important thing is a recording of an ECG can rule out or confirm chest pain due to the heart. If the ECG is normal, in all probabilities, your chest pain is not from the heart. Thank you for your kind attention. We'll meet another day with another topic of interest. This is Dr. Vijay Raghavan signing off. Bye.